Ozempic, it is literally the hottest drug in the country right now. But what happens when you stop taking it? Ozempic is part of a class of medication called GLP-1 against, and they are really important, safe and effective for people with type 2 diabetics. But about 10 years ago in the world of obesity medicine, it was discovered, as we do with a lot of medications, that there is a side effect may be beneficial, and we are talking about the side effect of weight loss. Fast forward, one of these medications recently was FDA approved for especially weight loss for people who are obese or overweight, and of course, like many medications, they are also used off label, especially and exclusively and deliberately to effect weight loss. These are usually injections. They are given by the individual, by the patient. In the belly is the most common location on the week. These medications are generally well tolerated. But one of the ways in which they work is by the slowing the emptying of the stomach. So one of the side effects, not surprisingly, can be GI, nausea, in some cases even vomiting as diarrhea or bowel issue, and in rare cases pancreatitis and inflammation of the pancreas, and these drugs do carry a black box warning for a rare type of thyroid cancer. So what happens if someone were to take one of these medication like Ozempic, lose some weight and then discontinue or stop taking the medication? Obviously it's variable, it's not one size fits all. An individual result and long term results will tend to vary, but in general we have to remember that condition of overweight and obesity are complex chronic disorders that have a multitude of factors leading to them. Behavior is one of them, environment, genetics, even other medication that may be associated with weight gain are a big part of the picture. So if you remove one of those variables, in this case a medication that has been helpful in achieving weight loss, it is possible, if not likely, that the person will regain some or all or even more of the weight that they have lost. It depends on how much was lost in the first place, and it's depend on the person and their individual specific factor. I am ready to give it. I just pull the end off just like I would a regular needle in a facility. So you can see I got my teeny tiny little subcube needle. Mine goes in my abdomen, so I select my abdomen. I am going to pinch it. I like to insert it at a bit of an angle, so I am going to insert the needle and then I put my finger on the end here and click this button, and you will hear it click as it insert the dose, and this plunger move down. You and it's done, and so I leave mine in for 6 seconds. Different medications are different, and then I pull it out at the exact same angle. Thank you.